Have you ever wondered why you might not see things as clearly as you used to? It's not just about needing stronger eyeglasses, there could be more to it. One common reason for changes in vision, especially as we get older, is a condition called glaucoma. Let's explore what glaucoma is, why it's important to find it early, and how you can go about detecting it. Glaucoma is a group of eye diseases that damage the optic nerve, which is vital for good vision. This damage is often caused by abnormally high pressure in your eye. You might think of eye pressure like the air in a balloon. Too much pressure, and it can cause problems. But unlike a balloon, your eye won't pop. Instead, the pressure can harm the optic nerve over time, leading to vision loss. Now you might be wondering, how do I know if I have glaucoma? That's a great question. Glaucoma is sneaky. It usually doesn't have symptoms at first, which is why it's often called the silent thief of sight. Many people don't realize they have it until they start losing their vision. By then, the damage is already done, and it can't be reversed. That's why finding glaucoma early is so important. So how do you catch this sneaky condition? The first step is knowing your risk factors. While anyone can get glaucoma, certain factors increase your chances. Age is a big one. Glaucoma is more common in people over 60. Family history is another. If your parents or siblings have glaucoma, your risk is higher. Other risk factors include high eye pressure, thin corneas, being very nearsighted or farsighted, having diabetes, and being of African, Asian, or Hispanic descent. Knowing your risk factors is crucial because it can prompt you to get regular eye exams. And regular eye exams are the key to catching glaucoma early. But what happens during an eye exam to check for glaucoma? When you go for an eye exam, your eye doctor will perform several tests to check for glaucoma. Let's walk through some of these tests so you know what to expect. First, there's the tonometry test, which measures the pressure inside your eye. Remember the balloon analogy? This test helps the doctor see if your eye pressure is too high. There are different ways to measure eye pressure, but one common method involves a quick puff of air onto your eye. It's painless and over in seconds. Next, your doctor might do a visual field test. This test checks for blank spots in your vision that you might not even notice. During this test, you'll look into a machine and press a button every time you see a light. It helps the doctor map out your vision and see if glaucoma has started to affect it. Another important test is the optic nerve assessment. The doctor will look at your optic nerve using a special microscope and a bright light. This might sound a bit intimidating, but it's actually quite simple. They might also take photographs or use imaging tests to get a detailed view of your optic nerve over time. This helps track any changes that might indicate glaucoma. Pachymetry is another test you might encounter. This measures the thickness of your cornea, the clear front part of your eye. Thin corneas can be a risk factor for glaucoma, so this test provides valuable information. Your doctor might also use gonioscopy to examine the drainage angle of your eye. This is where fluid inside the eye drains out, and if it's blocked, it can increase eye pressure. During this test, your doctor will place a special lens on your eye to get a better look at the drainage angle. Now you might be thinking, that sounds like a lot of tests. But don't worry, these tests are quick, painless, and essential for detecting glaucoma early. And the best part? Early detection means you can start treatment right away to protect your vision. Speaking of treatment, what happens if you're diagnosed with glaucoma? The goal of treatment is to lower eye pressure and prevent further damage to the optic nerve. There are several ways to do this, and your eye doctor will help you decide which treatment is best for you. The most common treatment for glaucoma is prescription eye drops. These drops help reduce eye pressure by either decreasing the amount of fluid your eye produces or helping the fluid drain better. It's important to use these drops exactly as your doctor prescribes because they're crucial for controlling the pressure in your eye. If eye drops aren't enough, your doctor might suggest oral medications. These pills work in a similar way to eye drops, but can be more effective for some people. In some cases, laser treatment might be recommended. One common laser treatment is called trabeculoplasty. It helps improve the drainage of fluid from your eye, lowering the pressure. Another option is laser iridotomy, which creates a small hole in the iris to improve fluid flow. If these treatments aren't effective, surgery might be necessary. There are different types of glaucoma surgeries, such as trabeculectomy or implanting drainage devices, to help reduce eye pressure. Your doctor will discuss the best surgical option for you if it comes to that. Managing glaucoma is a lifelong commitment, But with the right treatment and regular eye exams, many people with glaucoma can maintain their vision and lead active lives. It's all about being proactive and working closely with your eye doctor. So what can you do today to take care of your eyes and reduce your risk of glaucoma? First, make sure to schedule regular eye exams, especially if you're over 60 or have other risk factors. Don't skip these appointments. Your vision is too important. Second, protect your eyes from injury. Wear protective eyewear when doing activities that could hurt your eyes, like home repairs or sports. Eye injuries can increase your risk of glaucoma, so it's best to be cautious. Third, live a healthy lifestyle. Exercise regularly, eat a balanced diet rich in fruits and vegetables, and don't smoke. These habits are good for your overall health and can help reduce your risk of glaucoma and other eye conditions. Finally, stay informed and keep learning about glaucoma and other eye health topics. Knowledge is power, and the more you know, the better you can take care of your eyes. If you found this information valuable, please give this video a thumbs up, share it, and subscribe to our channel for more insightful content. As always, take care of yourself, and thanks for watching.